So then you see a lot of people with back pain and neck pain here at Sports and Spinal Physio. Can you tell me the sort of patients you typically treat with the IDD therapy as opposed to, you know, the standard manual therapy programs that you offer?
Yeah, sure, Steve. I mean, we see a lot of people with back and neck pain. Predominantly, the patients that we select for IDD are the patients with disc problems. So herniated discs, degenerative discs, bulging discs, that kind of thing, really.
And what does a herniated disc look like? I mean, people say they've got a slipped disc. Somebody said, "Well, I've been told I've got a slipped disc." What does that involve?
Okay, a slipped disc essentially is where the soft inner part of the disc breaks through the outer casing of the disc, a bit like a donut being squeezed and the jam coming out.
You're treating a targeted segment. Why would you use a machine rather than your hands to do that?
I mean, the biggest difference is the amount of force that we can apply to this particular segment. So with the IDD machine, we can apply a force to a specific targeted segment over a longer period of time.
Right, and that has benefits for the disc. What does it? I mean, a lot of people with back pain they get very stiff. Is that right?
That's correct. Yeah. So the IDD allows us to mobilise the specific segment that is giving the person problems. By mobilising the segment, we'll improve the nutrition across the disc, make the joints more flexible. And some of the studies have shown that the disc on the MRI scan can actually, the bulge of the disc on the MRI scan can actually reduce in size over time. So through mobilising the joint and the disc, this allows the body to heal itself, and in healing the disc, the person will feel better, will have less pain, have more mobility, more flexibility, and then will be able to live a more active life, which in turn also helps to help the disc and the joints.
When somebody comes for treatment, how quickly can they expect to see improvement?
Initially, the person might see some small change in their symptoms, but normally we're looking for the person to come in for a series of sessions over a given amount of time. And for the reason for this is that there are small changes that take place when the person is undergoing IDD therapy. I like to compare it to going to the gym. You wouldn't expect to see muscle changes after 2 sessions at the gym. You'd normally go for several weeks before you actually started to see some changes within your musculature and your fitness. And IDD therapy is very similar to that. We do see changes, but these are small incremental changes over a series of weeks.
Right, so you're progressively changing the soft tissues with a goal to what?
With a goal to improving the mobility of the joint, the nutrition and the health of the disc. And if we can do that, we'll see some changes within the disc itself. And these changes will make the person start to feel more mobile, more flexible, and as such, and in turn, their pain should diminish.
So when patients come to you, and perhaps they've heard about IDD therapy, I mean, do you treat everybody with IDD therapy, or?
No, certainly not. Some of the patients that come to us aren't suitable for IDD therapy. We are getting more and more patients through the door asking about IDD therapy, but some of them, their conditions just doesn't suit the machine. So we'll either refer on to a surgeon, for example, or they might undergo rehabilitation with us, or even just some hands-on manual therapy.
Right. Thanks, Dan. That's great.